Did you know alcohol can stay in your body for days, sometimes even weeks, after just a single drink? And for seniors over 60, the effects last even longer than most people realize. What if that one glass of wine at dinner, or that toast at your grandchild's wedding, is still affecting your health long after the moment has passed? Today, we're uncovering 5 hidden truths about how long alcohol really stays in your system, and the shocking ways urine, blood, and even your hair can expose it. As we age, our bodies change in ways we often don't notice until something feels different. One of those hidden changes happens in how we process alcohol. When you were 40 or even 50, your body could handle a glass of wine or a bottle of beer fairly quickly. But after 60, that same drink stays with you much longer. Why? Because your metabolism slows down. Your liver processes alcohol more slowly, and your body holds less water to dilute it. This means alcohol not only lasts longer in your system, it hits harder, too. Think about this. That single glass of champagne at a wedding, or a toast at a family gathering, may leave you feeling fine in the moment. But hours later, and even into the next day, alcohol could still be in your bloodstream. For some seniors, it can linger even longer. And while that might not sound like a big deal, the truth is, it can increase risks you may not expect. Alcohol that stays in your system raises the chance of dizziness and falls, one of the biggest threats to independence after 60. It can also interfere with memory, leaving you feeling foggy or confused the next day. And perhaps most concerning, it can dangerously interact with medications for blood pressure, diabetes, sleep, or pain. The drink you thought was harmless could multiply the side effects of your prescriptions, sometimes in ways that catch people completely off guard. But let's pause here. This isn't about judgment. This isn't about saying you should never enjoy a glass of wine or celebrate with friends. Life is meant to be enjoyed. Instead, this is about awareness and safety, about knowing how alcohol works differently in your body, now compared to 20 years ago, and making smart choices that keep you healthy, independent, and able to live life fully. Because here's the empowering truth. When you understand how your body has changed, you can take control. You can enjoy life without putting your health at risk. And over the next few minutes, we'll uncover the 5 hidden truths about how long alcohol really stays in your system, including the surprising ways it can still be detected through urine, blood, and even your hair. Hidden truth number 1. Alcohol lasts longer in seniors. Here's why. After age 60, your liver, the organ responsible for breaking down alcohol, becomes less efficient. It still works, but not at the same speed or strength as it did when you were younger. Think of your liver as a filter. In your 30s or 40s, it was like a brand new coffee filter, clear, strong, and able to process alcohol fairly quickly. But over the years, that filter begins to wear down. By the time you reach your 60s and beyond, it's slower, a little weaker, and far less able to keep up with the same pace. This means alcohol doesn't leave your body as quickly as it once did. A drink that your body might have processed in just a few hours when you were younger can now take much longer, sometimes twice as long. For example, a younger adult may metabolize a standard drink in about 1 to 2 hours, but for many seniors, it can take far longer. And during that extra time, alcohol continues to circulate in the bloodstream. This explains why some seniors feel tipsy or lightheaded even after just half a glass of wine or a single beer. It's not that you're weaker, or that your tolerance has changed in the usual sense, it's that your body itself has changed. Your liver filter is slower, your body holds less water to dilute the alcohol, and your metabolism simply can't push it out as fast as before. Now, here's the part most people don't realize. This slower processing doesn't just make you feel the effects longer. It also increases your risks. If alcohol is staying in your system longer, you're more likely to feel off balance, more likely to struggle with memory lapses, and more vulnerable to interactions with medications. And because the effects can sneak up on you, it's easy to underestimate just how much one small drink can change the way you feel, move, and think. But here's the reassuring truth. Knowing this hidden reality gives you power. When you understand that your body processes alcohol differently after 60, you can make smarter choices, like pacing yourself, staying hydrated, and being more mindful about when and how you drink. It's not about giving up the things you enjoy. It's about protecting your health and independence by working with your body, not against it. Hidden truth. Number 2. Alcohol stays detectable in your urine far longer than most people realize. Here's how it works. When you drink, your body breaks alcohol down in two main ways. First, there's the actual ethanol, the alcohol itself, circulating in your blood. This is what gives you that buzz or tipsy feeling. Ethanol usually clears out in less than a day. But here's the surprising part. Your body also produces something called metabolites. One of the most important is called ethyl glucuronide, or EEG for short. And EEG doesn't disappear quickly. It stays behind as a kind of chemical footprint of alcohol. That footprint can be picked up by urine tests for much longer than ethanol itself. In fact, some sensitive urine tests can detect alcohol use for up to 80 hours. That's more than 3 days after your last drink. Now, let's put this into perspective. Imagine you go to your grandchild's birthday party and join in a small toast with just half a glass of champagne. By the next morning, you feel fine. Maybe you even forget you had that drink. But if a urine test is done within the next 2 or even 3 days, it could still show positive. Surprising, isn't it? And for seniors, this matters even more. Why? Because your body processes alcohol more slowly. Those metabolites can build up and linger longer than they would in someone younger. That means even light drinking can leave a chemical trace that lasts for days. But the real takeaway isn't fear, it's awareness. Whether it's for a medical checkup, a medication adjustment, or even just your own peace of mind, knowing how long alcohol shows up in your urine can help you make informed choices. It can save you from surprises, and it can protect you from unnecessary health risks. Hidden truth number 3, blood tests don't lie. Here's what you need to know. When you drink alcohol, it doesn't just sit in your stomach, it passes quickly into your bloodstream. That's why you start to feel the effects within minutes. But here's the catch. Even when you feel sober, your blood may still be carrying alcohol. Scientists measure this using something called a half-life. That simply means how long it takes for half of the alcohol in your system to be broken down and cleared away. On average, your body processes about 1 standard drink per hour. But after 60, things change. Your liver is less efficient, your water levels in the body are lower, and your metabolism has slowed. The result? Alcohol lingers in your blood longer than it used to. For most adults, alcohol is detectable in the blood for 6 to 12 hours after drinking. But in seniors, it can be longer, sometimes much longer, depending on your health, your medications, or even how hydrated you are. That means a glass of wine at dinner could still be measurable in your bloodstream the next morning. And here's the dramatic truth. Even if you feel fine, your blood may still carry the truth. You might not feel tipsy, you might not feel any buzz at all, but a blood test will show the reality of what's happening inside your body. Why does this matter? Because blood alcohol levels don't just matter for legal reasons like driving. They also matter for your health. Doctors may run blood tests before prescribing medication or during routine checkups. If alcohol is still present, it can change the results, affect your treatment, or even raise questions you weren't expecting. Think of your blood as a mirror. You might be able to hide how you feel on the outside, but inside, that mirror reflects the truth. And unlike urine or breath, blood tests are considered the gold standard. They're the most accurate and the hardest to argue with. The good news? Awareness is power. Knowing that alcohol stays in your blood longer as you age helps you plan smarter. If you have a doctor's appointment in the morning, or if you're starting a new medication, it may be best to skip that nightcap. Protecting your health doesn't mean never enjoying a drink, it means knowing how your body has changed and adjusting wisely. Hidden truth number 4. Your hair holds secrets your memory can't. When most people think of alcohol detection, they imagine breathalyzers, blood tests, or maybe urine samples. But here's the shocker. Your hair can tell the story of your drinking for months. Yes, months. Here's how it works. Every time you take a sip of alcohol, your body breaks it down into smaller chemicals called metabolites. Some of these metabolites travel through your bloodstream and embed themselves in the growing hair follicles on your head or even your body hair. And once they're there, they don't just vanish overnight. They become part of the hair strand itself, locked in like a fingerprint of your drinking history. The result? Hair tests can detect alcohol use for up to 90 days. That's 3 full months. Think about it. A glass of champagne at a wedding, a holiday toast, even that single beer on a warm evening. Your hair could be quietly recording every one of those moments long after you've forgotten them. And here's the uncomfortable truth. Your hair can remember what your brain has long forgotten. That means even if you don't feel the effects anymore, even if weeks have passed, the record of your drinking can still be discovered with just a single strand. Now, why does this matter especially for seniors? Because more and more doctors and healthcare providers are turning to hair testing for long-term insight into alcohol use. For older adults managing chronic conditions, taking multiple medications, or preparing for surgery, these tests can reveal patterns that short-term tests miss. In some cases, insurance companies or medical specialists may rely on hair tests to decide what treatment is safe or necessary. Imagine this. You're sitting with your doctor, confident that your blood and urine are clear, but suddenly, the hair test reveals alcohol from weeks ago. For many seniors, this can be life-changing, not because of judgment, but because it changes the way your doctor sees your risks, your treatment, and your overall health. The key takeaway isn't fear, it's awareness. Knowing that hair holds your body's secrets for months allows you to make smarter choices. If you know an important surgery, medication adjustment, or medical review is coming up, it may be wise to step back from alcohol sooner than you think. Remember, your hair is like a diary you didn't know you were keeping. The question is, what story do you want it to tell? Hidden truth number 5. Alcohol and medications don't mix. And for seniors, the risks can be dangerous. Here's what most people don't realize. As we age, not only does alcohol stay in our bodies longer, but the number of medications we take usually increases. From blood pressure tablets to diabetes medication, from painkillers to sleep aids. Every one of these drugs is carefully designed to work in a precise way. But when alcohol enters the mix, that balance can collapse. Let's make this real with a story. Imagine Margaret, 72 years old, celebrating her granddaughter's graduation. She had one small glass of champagne. Nothing unusual, nothing excessive. But Margaret was also taking her prescribed blood pressure medication. Within an hour, she felt dizzy, lightheaded, and nearly fainted as she stood to take a family photo. The celebration turned into a medical scare. What happened? Alcohol acted like an amplifier, intensifying the effects of her medication. For blood pressure drugs, that means your pressure can drop too low. For painkillers, it can strain your liver and cause drowsiness. For sleep aids, it can dangerously suppress breathing. Even common medications like antihistamines or antibiotics can react badly with alcohol. And here's the hidden danger. Many seniors don't feel the warning signs until it's too late. A single drink, which might have seemed harmless years ago, can suddenly trigger dizziness, confusion, or even a fall. And falls are one of the biggest risks for older adults, leading to broken hips, hospital stays, and long recoveries. This is why doctors and pharmacists are so quick to caution seniors about alcohol. It's not about being strict or taking away your enjoyment. It's about protecting your independence, your safety, and your quality of life. One simple glass, mixed with the wrong pill, can make the difference between a peaceful evening and a trip to the emergency room. But here's the empowering truth. You have control. By keeping track of your medications, asking your doctor how alcohol might interact, and making mindful choices before you drink, you can prevent dangerous surprises. You don't have to give up every toast, but you do need to know your risks. So the next time you reach for a glass of wine, ask yourself, am I on any medication tonight that could turn this into a problem? That one small question could protect your health and your future. Now that you've discovered the 5 hidden truths about alcohol after 60, the real question is, what can you do to protect yourself without giving up the moments of joy and celebration that matter? Here are 4 simple, powerful steps you can start today. Step 1. Space out your drinks. If you do choose to drink, give your body time to recover. Instead of having 2 glasses of wine back to back, try sipping slowly over an evening or limiting yourself to 1. Think of it like pacing yourself on a walk. Slow and steady keeps you safe and balanced. Step 2. Track your medications. Keep a simple list of every pill you take, whether it's prescription or over-the-counter. Stick it on your fridge or keep it in your wallet or phone. This way, when you're about to have a drink, you can double-check if there's a possible interaction. This one habit alone has saved countless seniors from dangerous side effects. Step 3. Stay hydrated. Alcohol dehydrates your body, and dehydration can cause dizziness, confusion, and even falls, things seniors already face a higher risk of. For every alcoholic drink, aim to have a glass of water. It's a small action that makes a big difference in how you feel the next day. Step 4. Ask your doctor about your safe limits. This is one of the most important and most overlooked steps. Everyone's body is different, especially after 60. What's safe for one person may not be safe for another. By having an honest conversation with your doctor, you'll know exactly what works for you, instead of relying on guesswork or old habits from years ago. And here's the most important thing to remember. This isn't about giving up your freedom. It's about protecting your health, your independence, and your ability to keep doing the things you love. Whether it's dancing at a wedding, enjoying a meal with friends, or traveling with family, staying mindful of alcohol simply ensures you can enjoy those moments fully and safely. Think of it this way. Alcohol may leave hidden fingerprints in your body, but you have the power to decide what kind of story your health will tell. The choice is yours, and it can be a choice that keeps you strong, confident, and in control of your future. Now I'd love to hear from you. Did any of these 5 hidden truths about alcohol surprise you? Which one shocked you the most? Was it how long it stays in your blood, the way your hair remembers for months, or the hidden dangers with medications? Share your thoughts in the comments below, because your story could help another senior watching this right now. Many people over 60 think they're the only ones dealing with these challenges, but when you share your experience, you remind others that they're not alone. So go ahead, let us know which truth opened your eyes the most, or what personal tip you found helpful when it comes to staying safe and healthy with alcohol. Your voice might be exactly what another person needs to hear today. If you found this video helpful, make sure to hit that subscribe button and join us here at Senior Sense. This channel is dedicated to bringing you clear, eye-opening health tips that help you stay safe, strong, and independent after 60. Subscribing isn't just about catching another video. It's about joining a community of seniors who are choosing to take control of their health, one smart step at a time. And when you subscribe, you're telling YouTube that you want more life-saving information like this delivered straight to you. And here's a little sneak peek of what's coming next. In our next video, we'll reveal 7 common medications that can become dangerous when combined with even a sip of alcohol. These are everyday prescriptions many seniors already take, and the risks may shock you. This is one video you don't want to miss, because knowing these interactions could protect you or someone you love. So don't forget, like, subscribe, hit the notification bell, and stay with us. Because every week, we bring you the knowledge you need to enjoy your golden years with confidence, safety, and peace of mind.